I'm Micheal Klein. I'm a pediatric surgeon from Detroit.
Oh.
Actually, for a long time, I was the surgeon-in-chief at the Children's Hospital of Michigan in Detroit. There was a nurse anesthetist at Henry Ford, where we also work, who told me about the missions that she goes on and organizes it, and it sounded great because it was 10 days, so that you could take 2 weeks off and still, do the whole thing. And the first time I went there, it was wonderful. I really enjoyed it. So probably the biggest kind of case we would do would be thyroidectomies. We did a lot of hernias, a lot of localized lumps, bumps, and tumors. In children, it's very important to do circumcisions in Africa because AIDS is so rampant. The outcome I want is just one person to be able to be happier and lead a normal life. Helping one person at a time is rewarding, and for them it is an incredibly big deal. A memorable story. It is not the most incredible surgical story, but as a personal story, a 19-year-old boy with an undescended testicle. We usually fix undescended testicles when children are less than a year of age. I just remember doing the operation, and afterwards, when he woke up, he said, all he did was he said, thank you, and he just hopped out of bed and left. I said, don't you need any pain medicine or something? And he said, no, everything is fine. Thank you very much, bye. Some people who actually studied it have noticed that that is one of the things we can learn. The response to pain is just very different in other civilizations. The first time I went, we had the old-fashioned headlights that you plug into the big light box. I brought my camping headlight, which I thought was wonderful. In the operating room, it does nothing at all. I looked at all the lights and loops and things like that, and I was most impressed with Enova. I bought 2 of the refurbished or demo models to leave there, and they were so light and so bright. Nobody ever did a worse job because they could see too well. There's this thing called the recognition, decision, action sequence. If you can't see, then the recognition part is gone, and without that, the other parts really don't count.